All right, welcome back to Living with Amy. I'm Connie Fellman. We're here with Dr. Tyson Schwiesow from Tower Clock Eye Center. Thank you for joining us this morning.
Yeah, hello.
We're going to talk about cataracts, and I think we've all heard of cataracts, but can you explain what are they and how do we know if we have cataracts?
It's one of these things. It's pretty evident to patients typically. They'll know something's wrong with their vision. Usually, it will first present at nighttime. They'll get a little bit of glare with oncoming car headlights, maybe some trouble watching television, reading. They'll understand something's different. They'll go in, get their glasses checked, and they'll be told that they have a cataract. And basically what's happened is the lens in the eye here, which ought to be nice and clear, this is made of protein, and over time those proteins change and they become less water soluble and they become cloudy. And so when light passes through the eye, when it hits the cloudy lens, the light energy is scattered and is no longer allowed to create a fine point of focus on the retina.
So it makes things blurry.
Yeah, you get blurred vision, exactly.
And if I am diagnosed with a cataract, what are my next steps? What do I do?
I always encourage people to talk to friends, relatives, neighbors, look for shared experiences, who has had cataract surgery that they know. Certainly they can turn to the internet. I actually encourage that. A little bit of learning on the patient's part can go a long way. There's a lot of information now. Certainly you can go to our website, watch videos on cataract surgery, begin to learn a little bit about the process, what to expect when they get to the office, and then into the operating room.
Well, it's nothing to be afraid of.
Correct. It's a decision that is going to be made in cooperation with the patient, and that process will be led and initiated through us and through our staff, and just we really want that first initial visit to the clinic to be educational so that the patient can understand, should I have cataract surgery, and if so, how do I want to see after the operation? How do I want my outcome to end up?
So what should the patient do when they go to Tower Clock Eye Center for their cataract evaluation?
Number one, be prepared for some time. It's a process that involves several diagnostic tests to understand how do they see, are they nearsighted, are they farsighted, do they have astigmatism, what's their lifestyle, and then how do we want to sort of craft the operation to help to meet their goals after surgery. So we have lenses now and surgical techniques that can create a situation where a patient will be less dependent on glasses after the operation. And so we want to understand all these things and educate the patient about the process of surgery, maybe what some additional out-of-pocket expenses will be, and just what realistic expectations can be currently.
And you mentioned your website they can go to for information. Can you tell us what that is again?
Yeah, so it's just towerclockeyecenter.com, but basically there they can watch videos and begin to learn a little bit about laser-assisted cataract surgery, dropless cataract surgery, multifocal intraocular lenses, astigmatism-correcting lenses, and again begin to understand a little bit about the process. And that'll just simply help us to help them make a decision.
All right, Dr. Tyson, thanks for being with us here this morning.